In this video, I'm going to be talking about shin splints. What is it? What causes it? But most importantly, my 5 top tips to help you to get rid of shin splints. So let's go. Thanks for checking out the channel. My name's John, head therapist here at John W Sports Injury, helping you to understand your body, get rid of any aches and pains to ultimately achieve your sport, exercise, well-being goals. If that sounds like your type of stuff, hit that subscribe button, then the bell notification, and I'll keep you updated. But let's dive into talking about shin splints. Firstly, what is it? Well, the first thing that it is really, really painful and annoying. Shin splints is a term that really, we don't technically love the term shin splints because I think it makes it sound like a condition that it actually isn't, which is fracturing of the bone. What shin splints actually is, and really there's a couple of theories around what's causing the pain when we get this shin splinty pain, if you like. But what we have is we have the shin bone, our tibia bone, the main lower leg bone that takes our weight bearing, and it's a substantial bone. But into that bone we have muscles that attach onto that bone. Most notably, we have the tibialis anterior on this sort of front aspect of the shin, and then on the back of the shin bone here we have what we call tibialis posterior, which is almost a deep calf muscle, if you like, attaching onto the bone itself. Now, why is this a problem? Well, on the outer layer of bone we have a layer surrounding that bone called the periosteum, and in the case of the shin compartment here we have muscles directly attaching into that bone. And the most likely theory that we have as to why we get this condition or this stress-related syndrome is that these muscle attachments, when we're applying force through the shin, are applying that pressure and disturbing that bone or disturbing that periosteum. So that can cause bruising, bleeding, or dysfunction. So, and that's why we call it shin splints, because it's the pain around the shin, and it can feel like it's right on the bone, but it's more muscular structures causing a disturbance of that bone. Now, what are my 5 top tips in helping our patients, our clients, to get rid of this very common condition? Well, the first tip, which sounds quite obvious and perhaps simple if you like, is to stop and think. Let me explain that point a little bit more. The biggest cause, or when we seem to see shin splints pain occurring, is when we either get one of 3 things. An increase in the volume of the exercise that we're doing, an increase in the intensity of the exercise that we're doing, or a change in the surface that we're completing our exercise or intensity on. So we tend to see this perhaps at start of football seasons, or somebody who's increasing their running mileage dramatically. If we suddenly change something about the volume or the impact of what we're doing upon those shins, then actually that can create some of this pain quite quickly. So I always urge people to stop and think, are you making your way through some sort of training program where you've suddenly increased the mileage? Perhaps a bit more than you know you should do? Have you returned to sport after not playing for a while and you've ramped up that volume and it's creating that pain in the front? Another thing that I talk to people about is, have you changed or are you wearing the right appropriate footwear? So for example, I might work with tennis players who try to stay fit during perhaps the off season or when they're off court, and they use their tennis shoes to then go running. And this is a typical thing where I often say that shoes are designed for the sport. So running shoes are designed to support the motion of running. Shoes are designed to give you the benefits of what is required on a tennis court in terms of stability and speed. Same with football boots. So if you know that you're not doing something sensibly and you're getting this shin pain, that could be an easy win for you to stop, think, and either pull back on the training load. Think about the surface that you're working on. Are you working on a hard surface and you can change this to a soft surface? Or are you actually wearing the right footwear that might be supportive for the task that you're doing? So once we move beyond this, we also need to think that one of the good things about shin splints pain is that a lot of the time it might be as a result of this changing volume, and the body can adapt to it. So one of the things that it can do is it can start to settle down. quite quickly, almost naturally. And that's why my next tip is that it's one where we can straight away think about managing the symptoms. Now, normally managing the symptoms isn't my first port of call. What we want to do is find the cause, which we're going to come on to shortly in this video. But with shin splints, because sometimes it's just the body getting used to new training volumes, or perhaps a return to pre-existing training volumes after a break, then actually managing the symptoms can be very helpful. And we know that this is an inflammatory condition. We're creating this force acting onto this periosteum, creating an inflammatory response, which is resulting in soreness. So managing the symptoms with something like ice can be really helpful. So just applying ice, and often with shin splints, I talk about taking an ice cube and literally rubbing it up and down the sore part of the shin, along either the inside of the bone or the outside of the bone, or both if you're troubled on both sides, until that ice cube melts. And that can be really handy in just managing those symptoms while the body starts to adapt. But if we want to go a bit deeper than this and we want to address some of the other things, then my third tip is that we can start to think about stretching these relevant muscles. And so here what we're talking about is this calf complex in particular. So what we have is we have the gastrocnemius, we have the soleus, we also have, as I mentioned, this tibialis posterior muscle lying deep to those. So we can achieve those by stretching out each of those three things. The gastrocnemius is the stretch where you have your foot behind you, but the leg nice and straight as you bend the front leg forwards. The important thing here is that we're keeping the back leg straight in order to target that gastrocnemius muscle. Then dropping a little bit deeper and lower, we've got the soleus muscle. This is when we do the same type of stretch, but what we're looking to do now is that back leg is bent as well. So we often bring the feet a little bit closer together in order to achieve that. But by bending both of those legs, you'll feel that stretch move a little bit deeper. And that's one that might really start to impact as this muscle attaches into that area. And then, as I mentioned, we've got the tibialis posterior. Now, to get to that quite nicely, we can take that same soleus stretch and just turn the heel outwards. And as we turn that heel outwards, you'll feel that catch the inside part getting deep into that tibialis posterior. A reminder that these static stretches you should be holding for 30 seconds. So working through this calf complex, what we can look to do here is we can work for 30 seconds in each of those three muscles. Moving on to my fourth tip, and this is where we might start to look to do some self-massage work, some alleviating of some of the, or improving of the tissue quality of these muscles that might be impacting. If we've taken to running, if we've increased our volume, we might start to feel these sore points and these dysfunctions. So something that we might like to do is apply a little bit of lotion around that shin bone. Take something like our thumb and we can just look to work into that area. And if you find any of those sore parts, we can start to do what we call a trigger point therapy work, where we look to apply some pressure into that area. If you find a sore point, we can then do what we call a pin and stretch technique. So find that sore point and hold into there. And it might take 30 seconds to a minute, but what you'll start to feel is that muscle loosen out. Then from that point, what we can start to do is stretch that muscle. See, as I bring my toe up here, what I'm doing is stretching through that tissue and looking to use the pressure being applied to my thumbs to apply that pin as I stretch through that. And then we look to work further around the tissue. A reminder that some of the particular culprits are these deep inside muscles here. So look to work through there. Then we've also got the tibialis anterior. So this is where we get into this muscle on the other side of the shin. So if you're suffering on the outside of the shin, this is the area that we want to find. And again, if we can look to find one in here, we can then look to take that muscle through its range by pointing the toes down and then letting them ease back off, pointing the toes back down and letting it ease back off. But again, working into that area for perhaps 2 to 5 minutes. And if you have worked into that area for a period of time, that's a nice time to then look to apply that ice. Of course, when I talk about self-massage, it would be wrong of me not to go to one of my favourite bits of equipment, which is my trusty old lacrosse ball, and this can work really nicely in the inside of the calf area. So again, looking to work through that calf, find any sore points, any points of dysfunction, points of pain. If you find on that, and those who have followed my content will know that using the ball to work through this tissue, but in particular find this pin and stretch point to then work through. So you see I'm just pulling the toes up there as I use the pressure of the ball to work through there. So that's another really handy self-massage technique to then be looking to help the tissue to be placing less pressure onto those sore shins. My fifth and final point is around looking to do some strength work. Now, in this strength work, what ultimately we want to be doing first and foremost is to be very careful. We know that the condition's been caused by an increase in volume and perhaps an increase in intensity in the area. So what we want to be thinking here is that we don't want to be applying too much pressure too quickly. So I urge you to start this with some caution. But what we can ultimately look to do is to go into something like a calf raise exercise. Here we start with 2 legs, using the 2-legged calf raise version. And we're just looking to come up onto our toes and then slowly ease our way back down. Come up again and then slowly ease our way back down. Now, what we can then do, if we're feeling confident in that area, is we can then look to take that into the 1-legged calf raise. And if you're someone who's only suffering with shin splints on one side, this is where it becomes really interesting, because we can perhaps test the uninjured side first, doing a 1-legged calf raise, by just hooking the bad leg behind the good leg and coming up into that calf raise position. And then we can do the same on the other side. Now what you're looking for is, do you create any pain on that side, or do you start to fatigue perhaps on one side more than the other? And again, if you're somebody who's fatiguing through this area, we know that we've got a lack of strength. What that then means when we're on the sporting, exercise, gym environment is that these muscles are going to have to work harder as they fatigue, and they're going to place more pressure onto that shin. So by ultimately improving the strength of that area or its muscular endurance, long term that's going to help out our shin splints. But remember, this is an overused condition caused by too much volume. So what we really don't want to be doing is diving into too much volume too quickly. For the 2-leg calf variety of the calf raise, I'd be looking at 12 repetitions 3 times. For the 1-leg version, we'd be just looking to do 3 sets of 6 variations. So you get your 12 variations by doing each leg 6 times. So there we have our 5 tips. Firstly, we've got to think about it. Make sure that you're doing the right amount of training in the appropriate footwear on the appropriate surface. Then we can look to manage our symptoms. We can do this with things like ice as a nice anti-inflammatory. Then we want to be stretching out the muscles that are having a direct impact upon those shins. Fourthly, we've got our self-massage techniques in order to improve the tissue quality of the muscles that are attaching into those shins. And finally, when our symptoms have started to settle and it's appropriate, we can start to bring in a strength and rehabilitation program in order to allow you to return to that sport gym environment. I hope that's been helpful. If it has, can you do me a favor? Hit that like button below. That shows me that 1, you've made it to this part of the video, 2, it's the type of content you want to be seeing, and 3, most importantly, it allows others who might be suffering with shin splints to get a hold of these tips to help them. So do your good deed for the day and hit that like button. And actually, if you're hitting that like button, why not subscribe at the same time? Because then I'm going to keep you up to date on the next videos that we have. Speaking of which, here's another video to help you with your sport and exercise tips, and I'll see you on the next one.